Welcome to Hearing the Stories of Our Health, Perspectives of First Nations, Métis, and Inuit Youth, a podcast series produced by the National Collaborating Center for Indigenous Health, in partnership with Birchbark Collaborative. My name is Victoria Grisdow, and I am the host of this podcast. From May to July of 2025, 13 Indigenous youth came together in Winnipeg, Prince George, and Ottawa to develop digital stories on what health means to them. This podcast isn't a polished studio production, it's real talk. It's about Indigenous youth reflecting on their lives, their communities, and what health really means to them in a world that often forgets to ask them. In this episode, First Nations youth Miley Melnyk speaks about how this project got her thinking about the deeper meaning of what health is. Miley speaks of her goals towards a medical career and what that means to her as a First Nations youth. So first I'm going to ask you to introduce yourself, including your name, community, and age.
My name is Miley. I'm 16 years old. My family's from Sagkeeng First Nation, but I grew up in Winnipeg, Manitoba.
Okay, thank you for being here with us today. First, I wanted to ask about what your future goals are.
Honestly, I kind of want to go into healthcare. I want to be a nurse. I was thinking surgery. I used to want to be a surgeon, but I don't know if I want to go through all that school, But I definitely want to be somewhere in that area, nursing.
I mean, you want to go into a medical career, right?
Mm-hmm.
And as an Indigenous person, how do you think that's gonna impact you in the future working in that career?
When I'm in hospitals, even when I go to my practicums and stuff, I don't see a lot of Indigenous doctors and nurses around there. Actually, I kind of noticed that, and I don't know. I just found that interesting. But I remember this one time I broke my thumb. I was in the ER till 1 a.m. and there was this guy, this Indigenous man, I think, and he was asking for help. He didn't seem drunk, he didn't seem high or anything, but they were kind of not really listening to him. He was I don't know, I don't think they really believed him when he was talking about his pain, and that kind of made me feel off, I guess.
Did that make you just want to be somebody that can help create a change for that so people aren't treated like that?
When I grow up, I want to become a doctor, and I don't want to treat my people like that. I want to make sure they all get help, even if
Yeah, it's important to be able to treat everybody with dignity and respect.
Yeah, everybody deserves that.
Did the workshop impact the way that you think about health at all?
Honestly, I never thought about it. When I think of health, I kind of think of the hospital side, the everything, and when you guys were when we were having that conversation of what does health mean, and everybody was talking about mental health, I kind of forgot that was a part of it.
Yeah, health includes
everything. So many different things, and just made me think. The conversations we had, it made me think a little bit deeper about what health is, and I really like that.
Yeah, that's great. And so how was the workshop experience for you?
I think it was a really good experience. Even though we were in that little basement, there was lots of food, and I feel everybody was so nice, and I was kind of shy at first, but everybody was so welcoming. I think it was a really good experience, and yeah, I just felt comfortable to do whatever on my video and share it.
Was it cool getting to see it on the big screen?
Yeah, it was. Even though I go to school, it was cool to see my own stuff on the screen.
Was there anything in particular about the workshop, any skills that you were excited to learn about, or that you're glad that you learned about?
I thought it was really cool, using the microphones and being able to listen to my voice in the headphones. I don't know, I just thought all the equipment was so cool.
Yeah, getting to feel professional,
yeah,
all the editing.
And getting to do it by myself too.
If you did another digital story about health, would there be anything else you'd want to say about health?
There's a couple. There was I wanted to do about forgiveness, and how forgiveness, it's healing and it like lifts you up. Like if you like forgive someone, like it's like a burden and it like weighs you down. But then when you like forgive someone, it, like, you know, and that's like just good for your health too.
Your video focuses on the importance of community and friendship. How is that related to health?
Having my friends like was always like my escape, and like they always just made me feel so happy. I just like liked having like that good community around me. Having like a connection with someone, it can make you feel so much happier. You have good friends. Like toxic friends is not healthy, but like a good like community that you feel comfortable in, that you can like feel like you can talk to, I think that's really good for you, and that's like an important part of health people sometimes don't talk about.
Is there anything you'd like to share with other Indigenous youth who watch your video?
Make sure you have like a good community, good friends to surround yourself with. Even one good friend like can like go like a long way, help you out a lot. Someone to talk to is like always nice.
If you could describe what your digital story is about, what would you say?
My story was about how important my friends are in my life. Like I have like a couple like super close friends that I'm super grateful for, and they're all kind of like leaving me and it's like really sad. But I was just like talking about how grateful I am for them, for like the community that I have, and like the connections that we have in our memories. And I think it's important that everybody should have that, and everybody deserves that. Yeah.
I think that's, for the most part, most of the questions we have about health. Was there any like final thoughts that you had about health or the workshop and how that experience was for you?
The food was really good. Honestly, I had literally nobody to talk to about this because I don't know. And I feel like it was like good to like kind of get my thoughts out and express how I was feeling. And yeah, like I just thought it was like nice, like yeah. I think it was a good experience. Yes.
Thank you so much for joining us, Miley. I cannot wait to see what you do in the future, and good luck on your career path. We definitely need more Indigenous faces in medical careers, and I think you would be amazing at that. Okay, and it was great getting to know you in this workshop, and thank you so much for sharing your story with us in the digital workshop and on this podcast as well.
Thank you.
To hear more podcasts in this series, head to the Hearing the Stories of Our Health, Perspectives of First Nations, Inuit and Métis Youth on the National Collaborating Center for Indigenous Health website, NCCIH.ca. Music on this podcast by DJ Taj Rashid is licensed and royalty-free under Final Cut Pro software used as part of this project. Finally, a special thanks to the TD Foundation for generously supporting this project.